Here.
So we have about 7 minutes to take questions. So all the presenters can please come and sit.
Oh my God, I've never presented in front of people.
You can sit there.
I was nervous. Oh, well, you're very good. No, I don't think so. No, facilitator, you listened. You're there to listen, so it's kind of hard to. Okay. Oh my God, my picture is bigger.
Hi, good afternoon. I'm Chad Dickey. I'm with AIDS Vancouver in Victoria. Great presentation. I learned a lot. My question is for Ben. When it comes to where can I find access to the Angles magazine? Is there a database that I can reach that at? And one other question too. Will you be asking about quarantine? Because that was an issue back in the early 80s. It was proposed that we'd have an island off of BC's coast that would do it. And the reason why this is so relevant is because of the Betty Price in the United States had recently stated they should look at quarantining HIV population. So that kind of that understanding of what happened back then is so relevant now. But thank you very much for your answers.
Yeah. So Angles, it's funny. Angles is not very readily accessible right now. It's in SFU's special collections, so you actually have to go up to the 5th floor of the SFU library to look at it, or UBC has it in their special collections as well. But it's actually not online or archived anywhere, which is really, I think, a shame, because it is a really interesting resource to look at, and it was in a lot of ways a really great periodical. The likes of which we don't have in the community anymore. Very political, very activist focused. Maybe there's something like that out there still, but it doesn't look quite the same to me, at least. And in terms of asking about quarantine, we definitely ask about, so yeah, part of what we mean by asking really more open-ended questions is we ask about how the government was responding, and we kind of leave it up to participants whether they want to bring that sort of thing up. But it's absolutely coming up. Many people have a lot of thoughts and experienced Bill 34 and the Van der Zalm government's homophobic response to the epidemic is something that almost everybody touches on. And I know that talking to some of the people that we have lined up to talk to in the future, they'll definitely provide some insight on that, I think.
Hi, I'm Andrew Beckerman. I hate to correct Chad because he's always smarter than I am, but he's actually here from AIDS Vancouver Island. He's not here from AIDS Vancouver, unless you've changed boards. Regardless, since we're talking about then and now, I just wanted to mention a film I saw at the Vancouver International Film Festival last month, it's a French film, BPM, Beats Per Minute. It's about ACT UP in France in the 90s, just before the release of, just before the first Crixivan trial, I believe. I'm seen by the anal dysplasia clinic thanks to the fact that 10, 11, 12 years ago, I was at a gay men's health summit, and Mark Gilbert and Natasha Press did a presentation, and I remain of a relatively small sample that is seen by the anal dysplasia clinic, because the anal dysplasia clinic happens to be here and not on Vancouver Island, and there's rarely any money to pay people to come here. But if it weren't for the Gay Men's Health Summit, I would not be under first Natasha's care and now Troy. So shout out for this event. I'm also a past board member of Pacific AIDS Network. I was the positive member from Vancouver Island. And I had a very unexpected but very sharp separation from the Pacific AIDS Network, because a year ago, last May, we were at a face-to-face board meeting, and we had received a query from the BC Cancer Society wanting our support and signing on to a letter to the health minister, I believe, to support the expansion to men and boys to the age of 26. And as somebody who's HPV positive, I raised my hand. I said, well, how about me? How about all the gay men who are HIV positive? And we had a reasonable discussion, the end result of which was, we'll ask them. And of course they asked, and the BC Cancer Society declined to expand that request. And it was shocking to me, and the reason why I'm not on that board, the Pacific AIDS Network, is because the board decided to sign that letter rather than take a stand on the needs of people who were actually living with HIV. Mm-hmm. And so we think we know our friends, and I don't mean to diss PAN completely because they've done wonderful work. But in this case, for whatever reason, they decided that the BC Cancer Society was a more important person to be friends with than me, who at that time was ending my 6th year as a member of that organization. And I still bear that pain that it was okay to discriminate against me. And that's a board that has 6 HIV positive people and 6 non-HIV positive people. And I felt that the needs of HIV positive people were cast aside for who knows what. I think it's important that organizations need to be reminded from those of us who have history. In my case, I was infected in 1980. And of course, it's a miracle that I'm here. But that wasn't, that was the 20th century. This is the 21st century.
Sorry, I just have a couple of other questions since we've got some time. What I wanted to ask Kiffer was about the possibility of doing a, where did my question go? Here it is. One moment, I'll find it. About doing a life course ecosocial influence study, something that would look at the life course of HIV positive people and track and try to capture information around that, because it is I was thinking we could break it into the patient experience of HIV. So that's something that I was thinking about. I'll just throw that out there. And then I'm going to go to, I'm sorry, I missed your name, the doctor in the middle? Mark. No, next to Mark. Oh, Patricia. Yeah, sorry, yes, you. When it comes to things, I was thinking too, you mentioned about the relational component is essential to establishing connections. One of the other things too is, how about looking at the immigrant determinants of health? We've got the social determinants of health, the indigenous determinants of health, but also there are the components of the immigrant determinants of health, but also, and there's the people of color determinants of health. So there are all these different spectrums that add to the life course experiences of illness, of living with stigma, of living with being a gay person. So all of those parts and things are very interesting areas for future research, I believe. Tying those together and trying to capture the real life experiences of people that are gay, that are bisexual, that are transgender, and the challenges that they face as a patient, as a number of different issues, especially like being an immigrant, if a person's an immigrant, all the challenges that they face. It's just just something I wanted to throw out to you guys. Any comments you have on those, that'd be great.
So yeah, I think that's a great important thing to think about is the life course. It reminds me of a quote by Clifford Geertz, who says that we are suspended in a web of relationships that we ourselves have spun. And I think it's important that as we think about health, we think about those relationships that facilitate health and facilitate well-being, starting from the very beginning with a life course perspective of thinking of our parental-child relationships and sibling and peer group during the development of brain development and personality development, and how those affect ultimately downstream things like the type of choices you make around your health and the type of activities you facilitate to participate in health. And so I think a life course perspective is definitely needed, because we experience different things from different backgrounds. And if you don't take into account those things, then I think it's really difficult to say with any certainty what it is you're actually talking about. Because in public health, in really academia, we run into this problem of putting things in different academic disciplines. There's childhood psychology over here, and then there's, chemistry and biology over here, and then there's social psychology and anthropology here. And the real challenge is to bring those things together to understand the human experience as a whole. And I think that's what the life course theory is kind of designed to do, is to take a temporal ordering of things, looking back from an event like, does this person take PrEP, and following that back and see, well, what are all the preceding events in that person's life that lead to them being someone who might take PrEP, or get on HART, or whatever the outcome you're looking at might be.
Yeah, and I agree with your comment. I think you're inviting in that idea of relationship first. Let's get to know who our people are. And I look at epigenetics, the risk and protective factors that evolve through around someone's well-being across the lifespan. And are we really seeking to know the people? Or are we seeking to know ourselves first and our perspective of people? Because the only way we're going to break through stigma is to have a relationship with the people and allow them to tell their story, not to script a story for them. Or we've just reenacted the dominance and submission that really sits with some of that social stigma when someone else defines your story and defines your health care and defines the way you should love or have sex or whatever that looks like. And I think that epigenetics across the lifespan really allows us to hear story, gather that data is the lived experience, right? And then bring that forward and allow people to be co-researchers, co-participants, instead of the expert-only stance. We are experts on our lives if we're allowed to be.
All right, everyone, it's lunchtime. Thanks for the great presentation and great comments and questions. Have a great lunch.